Hello, welcome to SCAI-TV. I'm here with Chad Alvarez, and most of you know him as the face of SCAI-TV, but now he's on the other side because he also had the honor of presenting a late-breaking trial on CTO and stenting. So why don't you tell us a little bit about the trial and kind of what led you to do this research?
Yeah, thank you, Dr. Box. So we have our own registry. We started to build it up from 2010 to 2025. It's an ongoing registry. So we collected so far 5,000 patients. Out of these, 480 underwent CTO intervention. So what we're interested in, we know the patency of the CTO is low if you don't do any kind of intervention, or if you do dissection and no intervention done, or due to difficulty advancing stent or equipment. So we look to which one had a stent and which one who didn't have a stent. So we looked into the patient. So majority of them had a success rate was 60% crossing the CTO. An intervention was done using technique ADR or re-entry, but 80% had a PCI, 20% did not have PCI. So when we look at the data, we have only 30 days and also 1 year follow-up. There was no difference in terms of bleeding, contrast-induced nephropathy, and cardiogenic shock. But there was difference down the line in 30 days in terms of cardiac arrest favoring stenting, and also favoring cardiac mortality at 30 days favoring stenting. The numbers were very close, but was still significant, suggesting and favoring the stenting arm.
Wow. So, this is an area I think of great interest because it's a lot of unknowns and a lot of controversy. How do you see this changing the approach for CTO operators?
I mean, this is give hope that this is at least what we're doing for selected patients who have a good myocardial perfusion and they have no scarring. That means what we are doing is in the right direction. So far as we know CTO does not improve mortality. We know that from registries only. Unfortunately, this is not hard to recruit for trial. But it's a signal that's showing that at least if you select the right patient who have a viability and you are successfully undergoing successful PCI, maybe you are improving arrest and cardiac mortality in 30 and 1 year.
Wow. So where do you see this going in the future as far as more work with the registry, or do you think this could eventually lead to maybe some type of randomized trial?
Hopefully will lead, but again, bigger people like CTO operator than way bigger, and the field already struggled recruiting for this or launching trial. What I think will be nice is to have a collaboration of registry between multiple centers and look at the outcome collectively and see if the signal continue to show or there is just kind of a certain bias, or the registry has its own limitation.
Wow, well, that is very fascinating. Thank you very much for sharing with us.
Thank you, Dr. Boris, for having me.